let's start at the beginning. Treatment Abroad scheme. It's a European Commission scheme, and it is based on European legislation whereby the European community wants to promote the free movement of people and the free availability of services. So under the scheme, a country can allow its patients to go to another European Union or EEA, that's European Economic Area country, or Switzerland for treatment. And the payments are made government to government. The treatment under the Treatment Abroad scheme must be a treatment that's absolutely necessary and a treatment that's not available in Ireland. There are some overlaps with other schemes, but I'm just not going to go into it. It's not that, it's a little bit laborious. They're long and they require a lot of explanation. But in general, that's the purpose of the Treatment Abroad scheme, to allow patients like yourselves access treatments that you need that are not available in Ireland. Some treatments, we just wouldn't have the population of people with that illness to support the availability of those treatments in the country. That's why we buy them from other countries. The payments are made government to government, as I said. So when you go abroad to Uppsala, the Irish government, via the HSE, pays the Ministry of Health in Sweden for your treatments. It's a direct payment, so that's why you never see checks or anything going back and forth. The other thing that's little known fact is that under the Treatment Abroad scheme, there's no entitlement to travel. And again, the HSE, the Irish government, decided, well, look, in fairness, this is an extra expense on people, so we'll cover the air or the sea fares. We don't cover taxis, trains and whatever. And the rationale for that is, if you were a sick person in Cork and you needed to travel to Dublin for treatment, nobody would be paying for your train fares up to Dublin. So what they do is they look at what would be the difference if you were an Irish person having to go abroad, and the difference is the foreign travel. So that's what we cover. There's no eligibility to it, but we continue to cover it. The other thing that was mentioned quite a bit this morning, and just before anyone starts to ask or starts to apply, are trials. Clinical trials are not covered under the Treatment Abroad scheme or under any scheme by the HSE. Only clinical trials that take place within Ireland are eligible for funding. And clinical trials are always funded by the clinical trial itself. So if you're participating in a clinical trial, you can expect that your expenses, your medical expenses, maybe even your travel expenses, would be covered by whomever is sponsoring the trial. They are not ever covered by the HSE, and the reason for that is clinical liability if anything goes wrong. So we would have no control over trials in another country, so we don't fund them, and they're excluded under the terms of the scheme. So when your doctor decides you need a treatment abroad, they identify a specific treatment, and it can't be a catch-all phrase, my patient needs to go abroad for cancer treatment. It will just be sent back. We wouldn't even look at it. They must identify specifically what you need. And you heard Dermot talking earlier on about the referral letter. We use the referral letter to make sure that firstly your consultant has seen you, secondly that you know what doctor you're going to and what hospital you're going to, and that the doctor receiving you abroad has a clinical history. In a referral letter there's clinical history, probably a little bit of family background as well on you as a patient going to a doctor abroad. And that, with that referral letter travels clinical responsibility. So once that's issued, then responsibility for you then transfers to the hospital abroad until such time as he issues the discharge letter, and then you're transferred back to the care here in Ireland. So that's the reason for that. I mean, you might think, like, for God's sake, no doctor refers a patient abroad for specialist care. But take it from me, we've had patients who have been referred abroad who haven't seen their referring doctor in 2 years. And that's just not acceptable. I mean, you have to be seeing your doctor here in order to avail a treatment abroad. So then your application comes into us. We examine your application against the criteria under the scheme for funding. Is it legal in Ireland? Is it a proven form of therapy, as in it's not a clinical trial? Are you a public or private patient? Is the treatment available in Ireland? And then when we've all that done, we also send it to, in your case, it goes to Dermot. And Dermot will look at it and say, yeah, that's a valid case to go abroad. And then they're approved or not, as the case may be. So that's basically how the Treatment Abroad scheme works. Some cases, we have a time frame of 20 days for turnaround time on an application. It doesn't apply in the case of the NETS patients, and the reason being Dermot turns the advice around within a matter of days, even hours. And once we have that advice in, we can turn around an application in a matter of hours. So that's basically it. So I'm going to leave it open to yourselves to ask me specific questions now, if you have any.
What's the difference between, you were saying there about public and private patients?
Okay. Forgive me if I start to talk about legislation. Under the 1970 Health Act, a patient in Ireland who is entitled to care is a public patient and a person who's resident in Ireland. I heard somebody else earlier on asking about being from Australia. It gets into a whole other grey area, and I'm happy to talk about it. But basically, that's what that's about. A public patient has entitlement to funding under the Treatment Abroad scheme. A private patient does not. Okay, so if you're a private patient and you apply to us for funding, and we see on the application form you're private, the first thing we do is send the whole lot back to you and say, apply to your private health insurer in the first instance, because they're your insurer, not the HSE. If you are not a public patient, you are not entitled to public health funding unless you switch back to being a public patient. And again, I can start to get into circulars and what's involved when a patient switches from one to the other. But basically, if you're a private patient, you go to your private health insurer, and in a lot of the cases, private health insurers won't cover treatment in Uppsala. Then you come back to us, and at that stage, we will treat you as if you were a public patient, but not until you have exhausted your rights to your private health insurance provider funding. Okay, that way we make public funds go as far as we can make them go. That's the reasons behind that. Anything else? This could be very short.
You said there, Catherine, that usually Uppsala is not covered by private medical insurance. Are other PRT centres covered?
No, it's usually what they cover is treatment, and a lot of the times they will not consider the Some private health insurance consider the treatments provided in Uppsala unproven, so they won't fund them. But in the public health system, they're not considered unproven, so they are funded.
Do you fund the travelling expenses of somebody accompanying the patient?
Only if the consultant says the companion is necessary. Okay?
So, if you're going to the public service for the next treatment currently, but you do have private insurance, you go through the public one anyway.
If you're a public patient, you're entitled to all the benefits of a public patient, and you can switch from being one to the other. But I mean, we would never, if you send in an application form that says public, we generally take that at face value, but for us the giveaway is the headed paper that the consultant will write on, because if he's seeing you in his private clinics, he can only write the referral on his private clinic paper.
No,
and
I'm talking about going to the clinic.
yeah, if you switch to being a public patient into the future, absolutely no problem. It makes no difference whatsoever. You can immediately have established your rights.
I think the question is irrespective of whether you have private health insurance or not. If you're the public patient, then you have
Yeah.
the rights to it.
You, as a patient in Ireland, even if you carry private health insurance, you do not have to use it. You can opt to be either public or private. That's your choice.
Does it cover overnight expenses?
No, no. With Uppsala, because we don't cover accommodation, let's split this down into travel and subsistence. Right? Subsistence is your food, drink, and your overnight accommodation. So we don't cover subsistence. But with Uppsala, if a patient was coming over for outpatient therapy over a consecutive number of days, they would have made that patient an inpatient rather than have the patient accrue all those personal expenses. So we have an agreement with Uppsala. They use a hotel, which is far cheaper, and they put that hotel on the bill. So it is their contract with the hotel and they're using it in place of their inpatient bed, and it's much cheaper. So that's why your accommodation sometimes can be covered.
And would that apply to the carer?
Well, presumably you'll be in a double room. Most people bring a husband, wife, a family member, so it's usually a twin or a double room. And we wouldn't know, by the way. Sorry?
But if you're a patient in the hospital over there and your carer is in
In
the
the
hotel,
hotel, not
the carer
covered.
has to pay for their own.
Yeah.
Just a clarification there is, if you want to book a double room, sorry, Catherine,
Sorry.
they give you, you pay the increment yourself.
Oh, do they?
You pay directly to the hotel. Uppsala will cover the cost of a standard single room, and that's the agreement they have with the HSE.
Okay.
So it costs you about €20 extra per night to get a double room.
Okay. So that's manageable.
Just on the finances then, the person funds it themselves, and then they claim it back, is it?
Yeah, and I know for any of you who've probably gone in recent weeks or months, we have a backlog of travel claims. And the reason for that is the member staff who looks after travel claims is out sick. We're hoping she'll come back soon, don't know for sure, but we're moving staff around to deal with the backlog. So we are hoping to move that along, but it's just one of those things. I mean, people get sick, they're out of work for weeks and you expect them to come back, they don't, and then we have to try and move everything around to try and manage the backlog of work.
Is there any path for a person who doesn't have any money, they can't afford to get there, and they need the treatment, what can they do?
Yeah, look, there is. It's not something we highlight or advertise, but if we had a case last week where the couple couldn't afford to, they didn't have a credit card, they couldn't afford to pay for flights up front. So what they do is they come to us and they say, look, we just can't do this. So the reason we don't encourage this is because for me to get flights for that couple, I had to go to a national director to get approval. It is not as simple as me signing off on it. There's a particular travel agent that the HSE uses, and the approval has to go all the way to a national director, which is a ridiculous waste of time and effort and paperwork, but it's just the way it's done, just to make sure that I'm not booking flights for my cousins or anything. There has to be a paper trail, so that's why we can do it, but it's not the ideal way of doing it.
And what about through some of the community schemes?
The community welfare officers run exceptional needs payments. Unless you're already on a payment from the Department of Social Welfare, it's highly unlikely they will help you out. They will if you're already on any kind of income supplement, but if you're not, they won't. That's the general rule of thumb that they use.